All right, so we are going to get rolling. Welcome to the community convening hosted by the New Jersey Doula Learning Collaborative. If this is your first call with us, welcome. The NJDLC is an organization, a support organization by doulas for doulas that provides information and continuing education and community support to create sustainable doula practice across the state of New Jersey. Part of our work with the NJDLC is growing the doula workforce in New Jersey. So we have ongoing learning opportunities, lunch and learns, in-person gatherings, hands-on education for doulas, and community convenings just like this one. And today's call with Jill Wodnick has come about as a result of the recent legislation that's been going on in New Jersey. There was a bill passed 2 weeks ago that was then signed last week that protects the right of all patients in hospitals and birthing centers to have a doula present for their birth. And if hospitals have created doula policies, they are now responsible for having those policies published in a public-facing way. And it is clear that doulas are selected by the patient, not by the hospital. So if someone says, "This is my doula," that is their doula. That's how that works. So we wanted to talk about kind of how this legislation came to be and what we need to be aware of in New Jersey, what's going on in other states that we may see going on in ours. So um, I am so excited that Jill is here with us today. And Jill, if you don't mind, I'm going to let you give us an intro and then take us away.
Sure. I'm a New Jersey resident. I work in improving maternity care. I'm a longtime doula and childbirth educator, and I focus on maternal health policy. So I'm really glad to be here. I'm going to share my slides to start the conversation, but then I'm going to not share slides. These slides will be available. I already emailed them to Jodi, and links are on them. And I hope that these are just resources to continue helping all of us be informed and supporting each other. And I'm going to actually start kind of framing at a macro level that as we talk about policy and legislation, I want to bring up an issue brief by the U.S. Department of Labor Women's Bureau. That is one of the most important documents, in my opinion, that listened directly to doulas in 2023. The U.S. Department of Labor interviewed doulas in 3 states and found that one of the highest issues among us is doula burnout and low workforce retention. And when doulas themselves explained why they weren't staying in the field, negative interactions with clinical staff, traumatic births without the resources to process them, and inadequate childcare for unpredictable work schedules continue to be some of the most systemic challenges. And I just want us to hold this as we hold each other, as we're building community, as we are asking for our own sustainability personally and collectively, to really hold in mind this opportunity and the challenges. So just to level set, I use the definition of the 4 key roles of doulas. That is a collaborative document from Health Connect One, the National Health Law Center, Tewa Women United, and the National Partnership. Just reminding all of us that doulas do a confluence of care for emotional, physical support, education, information, advocacy, and practical hands-on loving kindness for the birth and perinatal experience. So Jodi talked about the New Jersey bill, and I'm so glad because I really just put together a little bit more of what's happening at the federal level, and hopefully we can have these conversations quarterly and keep in touch with each other and learn with each other. But one of the things that I wanted to just, again, giving this macro overview, is that there's been doula legislation about workforce development and then about the funding mechanisms. But what we really haven't seen, going back to what doulas need, that we really haven't seen any legislation to really address some of the, ways of really dealing with burnout and looking at systemic changes. I do believe that the financing mechanism is part of it, but it's not the whole thing. Okay, so why would doulas want to focus on policy and legislation? Why, if you're doing labor support, why would you also want to learn about legislation? Well, I use the language from the March of Dimes. They have a hashtag blanket change, and you can find this directly from their website. But they remind us that it's actual policy and legislation that makes a difference. Policy can, and they have areas that they advocate for, including expanding access to doula care. And of course, they don't do it as a standalone. Part of their health equity initiatives include expanding access to Medicaid, paid leave, group prenatal care, expanding telehealth, as well as midwifery and doula services. So, again, we know that we need legislation that's comprehensive. And I just think it's important that we understand that policies really do make a difference. So if we want more information, where can we start to go as individuals or regional doulas within a certain area? At the federal level, the Association of Maternal Child Health Programs has a bill tracker. And again, all these slides are sent. I can put websites in the chat in a little bit. But the Maternal Child Health Bill tracker will be a way to really kind of see what's happening, not just for doulas, but the entire landscape of maternal health bills. One of the pieces of legislation that was reintroduced last April is called the Momnibus, and that's 12 different iterative bills, all centering Black maternal health and maternity care in general. And the Century Foundation has a tool just to track those federal bills. And I just want to highlight one that's very specific to doulas. This one is called the perinatal workforce. And this one has both a Senate and a House of Representatives submission. And it was reintroduced at the federal level last April. So let's just go a little deeper with this one, because the workforce development is where we're seeing legislation. And so this bill is multidisciplinary. It establishes grants for education that would include physicians, nursing assistants, midwives, as well as lactation and doulas. And so this bill is really a team approach to building the maternity care workforce. And it has, again, Tammy Baldwin in the Senate and Gwen Moore in the House. And if this is something you want more information on, you can see if you're calling in from New Jersey, you can find out if your specific congressman or woman, because currently we only have 4 senators that have sponsored this and 98 in the House. And so this is just a little bit more about the Perinatal Workforce Act. And you can go to the Century Foundation, you can download their fact sheet, and you can follow this. But that's a great way for doulas to look at workforce development in terms of law. Very quickly, I'll also say that there is a bipartisan Doula Act, which would be supporting a pilot program to make doula care available for pregnant veterans. And then the Care for Moms Act, which is legislation for $50 million in funding to build the doula workforce and also focus on postpartum care. So these are really interesting. This language comes directly from the proposed legislation. So before we go on, I just want to take any questions or be willing to, is there anything in terms of federal legislation that we can talk about directly, or I'd be happy to go back and to a different screen that I shared, anything like that. This is a conversation for all of us. Or Jodi or Joni or anyone from the DLC, anything you want me to just show again? or start the conversation with?
Yeah, Jill. I think it's so poignant, the slide, I think it's the second slide you had referencing why doulas don't stay in birth work. As someone currently experiencing burnout, I that for me just it speaks very loudly. Um, and so yeah, I'd love to hear others' thoughts and their voices.
I echo that. I had asked Jill if she would share this slide this morning, having heard this information yesterday, that this is so relevant to what we're seeing in New Jersey. We talk so often about how burnout is the biggest challenge we face. Most people who take doula training don't stay in the profession long enough to certify. Those who do stay in long enough to certify stay in for less than 2 years. And that's just where we currently are. And to see that the Department of Labor actually paid attention to the doula's perspective on this. And what did you say the top 3 contributing factors they said were?
So it's negative interactions with clinical staff, bearing witness to obstetrical violence, traumatic births,
Right.
and inadequate childcare for unpredictable or on-call work schedules.
Yeah.
I'm very public that I don't do as much labor support as I used to do because I had some very significant family health issues the last few years, and I needed to know when I was going to work and when I was coming home. And there's so many different ways of ameliorating sustainability but it can't just be this extreme individualism, which is, I think, kind of marked doula care. And as more payers want doulas, I think there has to be some really interesting investment in capacity building for childcare at different times and embedding community doula programs with mental health professionals as we work to eliminate obstetrical violence and reduce and eliminate traumatic births. Just ways of really making sure a doula doesn't have to hold that without very gentle, reflective, somatic way of processing.
Right. Right.
So I noticed, this is Jennifer Sanchez from Blackbird Perinatal Care Community. I hope there's not too much background noise. You said something so important, and you talked about the lone wolf sense of being a doula. And since I left clinical practice as a midwife in 2018, this has been my deep dive is birth worker burnout, and this is what I do now. And the isolation is both a cause of burnout and it's also a downstream effect of burnout, right? There are 3 components of burnout that researchers have identified, and they are exhaustion, cynicism, and isolation. So that isolation begets more isolation, and it's important to identify it as both a cause and an effect, I think.
That's so powerful, Jennifer. I feel like that slide needs to be right next to this one. And
yeah, I think that it's all of the things that I talk about constantly every day are on this slide. It's negative interactions with clinical staff. You're basically talking about horizontal violence, even though doulas are not nurses. I think I would consider that horizontal violence, maybe slightly oblique violence, but mainly horizontal violence and moral injury. I mean, you're coming into a birth with a set of expertise and an outlook about how the birth should go, and you come in and you planned with your clients and you walk in, and now there's an institutional perspective on how the birth should go that isn't aligned with the values that you and the clients have defined for this birth. And so that's just constant moral injury. And then there are those like big ticket traumatic bad births, and it doesn't have to be that, right? It can be these tiny little moral injury episodes that build up over time.
Absolutely. And, yesterday, thanks to the leadership from the Partnership for Maternal Child Health of Northern New Jersey, they convened conversation about integrating doulas into healthcare systems. And I used this slide there too, and it reminded me that what the toolkit from California Maternity Quality Care about integrating doulas is having a culture that supports physiologic birth. And, yesterday, the midwife from St. Joe's and the nurse manager from St. Joe's were so able to articulate their own philosophy of supporting physiologic birth, and it's making it incredibly supportive to have very powerfully sustainable community doula programs because of that intentional care and that intentional design. And I feel like, that there is so much that we can learn with each other and from each other in terms of collaboration and team-based care for families. So I can, Joni or Jodi, I can keep going on or stop sharing, whatever works for you all.
Oh, I want to hear all of it.
Okay.
What's on your mind? Keep it coming. Let's
Okay.
go.
Okay. So I'm not that good at multitasking, but at some point I will put the Century Foundation's Momnibus tracker in the chat, and I want to also put the AmChip legislative tracker in the chat. Or if anyone else can do that, that would be very appreciated. And just really getting to know where you can find legislation. So the other element that's really impacting doula legislation is coming from the payers, where payers themselves, meaning insurance companies, managed care companies, Medicaid entities, are interested in accessing and expanding and working with doulas. And so yesterday, through the federal employee program, Blue Cross Blue Shield introduced a partnership with Mama Glow. And that is, again, just an interesting opportunity. And looking at how, again, the economics of healthcare and the role of who is financing peer support helps us understand some advocacy and some opportunities for education. So for example, Jodi was mentioning the New Jersey bill that just got passed. There were well-meaning members of the New Jersey Assembly in the healthcare that didn't understand that doulas do peer support, that do education, comfort measures, advocacy, but didn't do clinical care. And it took a number of sentences for them to understand that. And if they think that doulas are nurses or midwives, it's so problematic. So that kind of really so it's interesting. So payers and companies are really wanting to expand doula services. In November, Walmart added a doula benefit for employees. Microsoft and CVS also added the doula benefit also. This past summer, Utah required coverage of doula care for public employees. And if you can see on the bottom of that slide, it says State of Utah Benefits Guide. And they're calling doulas birth coaches. And is also interesting because the other policy area I spend a lot of time with is birth centers. And one of their big benefit changes is that they were putting birth centers that are in network now available to public employees in Utah. And we also saw in Oregon that doula services for women's correctional facilities are now authorized. So this again kind of shows this public-private interest in capacity building for doulas. And of course, the largest interest area has been Medicaid coverage for doula services. We saw more legislation in 2023, and we have some big news in 2024 in terms of expansion and reimbursement rates. This is out of order. Sorry about that. Okay, so let me go here a minute. This is a wordy slide, but I wanted to make sure it was accurate. Doula services in California on January 1st, so we're talking 4 weeks ago, increased to offer the highest doula reimbursement rate in the country. The Department of Healthcare Services in California expanded the payment mechanism for reimbursement for doulas through their new state plan amendment. And what this means is that doulas in California will be getting over $3,000. And that includes a number of home visits, labor and birth, and postpartum visits. Now you can actually look at this. This is published online. It's absolutely, they needed to make it visible. And this happened within 1 year. I mean, understand that California is so interesting because they had been working very collaboratively with community-based doula programs, and yet they were still seeing some challenges in enrollment and challenges in meaning provider enrollment, that there were thriving community-based doula groups in California, but there wasn't utilization. And that utilization means you may have a doula workforce of 600, but you may only have 60 doulas that are registered or through the credentialing of provider enrollment. And again, listening to doulas in California, the California doulas were like, we need a thriving wage. And so the role of legislation can often be about parity in reimbursement and increasing those reimbursement rates. So that's the thing I wanted to point out. Some of the biggest areas where we see legislation is about the payment mechanism. So earlier this week, one of my favorite websites, the National Health Law Program, you see their little logo on the bottom. They co-published a new report with the Bixby Center for Global Reproductive Health, and they looked at a cost-benefit analysis of doula care from public health. And I'm hoping this means all states can make sure that doulas have a thriving wage. And when we look at reimbursement mechanisms, that this report would add to the value of what consumers and doulas themselves and legislators can look at. Because it reminds us is that we have over half the states in the United States that have implemented or in the process of implementing doula coverage for Medicaid beneficiaries. And so that's where the other pieces of legislation are. This past year, there was a lot of reports about doulas. There's a lot of evidence, and there's a lot of information, and we need to keep listening to doulas and helping doulas be able to, who want to find their voice, to give testimony, to be subject matter experts, are known by the legislative, state and federal legislators, and share your voice. There's so many things we didn't talk about today, so I'm hoping we can keep going on in terms of what we're seeing in a granular level in some states in terms of requiring licensure in Arizona. So there's some major trends, but today I just wanted to focus on some of the federal tracking, and I wanted to focus on just the expansion of the public-private interest in doulas, and turn it back over to the DLC.
Well, while we're there, let's birdwalk here for a moment, because you're mentioning licensure, and clearly the opinion of the DLC and of many doulas is that licensure isn't a requirement, shouldn't be a requirement. Will you elaborate a little bit on why that is? I'm very aware that there are folks on the call who may not be doulas or who might be baby doulas saying, well, hey, why not? So can we chat about that a minute?
My personal opinion is that doulas are peer support, and we are not doing a work behavior that would require a license. I believe in training. I believe in competencies, but there's a difference in terms of licensure can really be a gatekeeping mechanism and does not often recognize the historical legacy and the exclusion and systemic barriers and privilege to keep people out of a profession instead of bring people in. So I just feel like we need a wider table. We need more doulas who want to remain in the profession. So licensure for me would accomplish nothing except excluding. That doesn't mean I don't like directories. I emailed Jodi yesterday. I was like, do we have a directory for this and that? Like, a directory is different. But licensure can be such a regulatory mechanism that has unintended consequences. In our profession, we don't need it. I understand with home-based childcare, that's different. You're bringing babies and infants into, there's roles for consumer safety. So that's my personal response.
Thank you, Jill. I want to allow room for others to chime in as well. I can talk about this all day.
At a time, I think, when we're trying to bring more people of the global majority into doula work, it's also a huge barrier to practice, to jump through licensing hoops, which, I mean, my little bugaboo about licensing is I've been a nurse midwife licensed in New Jersey since 2015, and I tried to get my WHNP license because I'm board certified, and I requested, I used to have my license in Pennsylvania, and I asked to have it sent to New Jersey, and that was in February of 2023, and I paid for it twice, and they never got it. So I've paid the licensing fee, I've paid the fee to have the records sent, I've paid the fee to have my transcript sent, and I still don't have a license a year later. So that's a barrier for everyone. But just the simple costs of all of these steps, the fingerprinting, the background check, the licensing fee, getting transcripts sent, all of it, it's a huge expense. And I think the time is right to be more inclusive of, concordant care. We know that concordant care, racially concordant care, gender affirming concordant care is much more successful. We have lots of data on that. And so opening doors instead of closing them seems to be what we're called to do right now. And I think licenses definitely close them.
Yeah. Thank you, Jennifer, for that. Any other voices, burning sharings, or questions?
There was a request to see the slide about the partnership again, and I'm not sure which slide. Melanie, can I put you on the spot I'd be happy to share the slides again. I'm just not sure which one you wanted to see.
It was like the announcement of the partnership of Mama Glow and the Blue Cross Blue Shield, the little circle one. I just wanted to read the bottom. I didn't get the chance to read the bottom part.
Got it. Absolutely.
Thank you so much.
Yes. So Mama Glow is led by Latham Thomas and has been working as part of the New York City Department of Health Community Doula Initiative called CDI. And then, so this is not New York City based where Mama Glow started community doula care, but now goes up for federal employees. And what's interesting when you read the Blue Cross Blue Shield, they actually are making sure that federal employees who've had a preterm birth previously are able to access this, and they're using it really as a social emotional protective mechanism as part of pregnancy care, because that social emotional care and that peer support that doulas offer really can be a buffer and a protective factor.
Thank you, Jill. That really is exciting. Exciting to see these things branching out. NJDLC has been reaching out to some of the organizations that are offering doula service as an employee benefit to ask what we can do to support employee communication, their public-facing communication on who doulas are and what doulas do. and what this benefit will provide, because it's quite possible that the employees of CVS, of Microsoft, of Walmart, of TD Bank might not know. A lot of people don't know who doulas are and what doulas do. So we're seeing how we can connect. And for folks who are interested in that, by all means, please contact the DLC. We have work groups that focus on this sort of outreach, and we welcome hands to the work. Just email us, please, and say, hey, I'm interested in helping with that work group. And we will connect you with what we've got going on.
And because I see Christina's here from Massachusetts, I think you're from Massachusetts, it's also a great way of doing interstate collaboration, really hearing directly about trends and challenges and opportunities from other regions and other states, and hearing how doulas have mobilized and done collaborative projects together. And, so for example, when I think of Massachusetts, I also think about the partnerships of hearing doulas that the March of Dimes did well before the pandemic. That, it was listening groups that involved childcare and food, and really got doulas together in regional areas to hear each other. And, those things that make a lot of sense doesn't mean that they're happening in other states. And just that ability to have a convener and focus on making sure that doulas can gather and that voices can be heard and recorded as key informants.
Mhm. I was seeing in the chat. The work that's going on in North Carolina, there's work going on in New York and in Georgia. There are currently 11 states that are in the process of developing Medicaid enrollment for doulas as providers. I think it's really important for those of us who have enrolled as providers in New Jersey that we keep giving feedback on what we're encountering with that. If you are eligible for New Jersey Family Care enrollment and you have not enrolled, please let me encourage you to do so. Even for the specific reason of amplifying what you do encounter as you're going through the process of that, because that's the feedback that we need, and we need to hear it broadly and not just from me. We need all the voices in on that one. We do have upcoming, since we're coming up to the end of the hour, I want to mention the upcoming meetings that we do have. I had the dates right here on my notebook. We have a fee-for-service support meeting happening this Saturday online from 10 to 12. That's going to be virtual, so anyone who's eligible for New Jersey Family Care enrollment. And if you're not sure, then you can email us and we'll chat with you about it. We also have office hours every Monday, every Wednesday, Monday from 11:30 to 1:30 and Wednesday from 1 to 3, where the New Jersey DLC staff is on office hours on a Zoom call, just like this one, available to answer questions, available to help you get your documents and things together for that enrollment. We'll walk you through the application and confirm where to send it. We're right here. Nobody's in this alone. Even though it's a complex process, it is a doable process, and we're here to support with that. So we do have those virtual sessions quarterly, one coming up this Saturday. We have a fee-for-service enrollment in our Central New Jersey office happening on February the 8th. That's going to be in Trenton, in our Trenton office at 6 p.m. We also have a fee-for-service enrollment support happening Saturday, February in South Jersey. That's in our Camden location from 2. So if you want that support, it's available. You can register for any of these through our website, which is njdlc.org. You kind of have to scroll down to find them, but they are on there on our events. You can register. We'd be happy to have you join us. We also have quarterly doulas and desserts gatherings. I love those. We have them in North, South, and Central Jersey. There's one every quarter. I do not have those dates in front of me. And I don't have my phone to pull them up right here, but if somebody on the team has them, they're also on our website, and you can find us on all the socials. We're on Instagram, we're on Facebook, we're on all LinkedIn, all the things as New Jersey Doula Learning Collaborative. And we always welcome more participants in all of the things that we are doing. You can sign up for our newsletter as well through our website. Stay in touch with events that we have coming up. And yeah, we'll keep you posted. That was the end of my upcoming announcements visits, except for when I get those doulas and desserts dates in front of me. We are combining our doulas and desserts next quarter with our hands-on labor support. So everybody who comes, we're just all going to practice. What's your favorite comfort measure to use in labor? Okay, everybody try it. And then have a cookie. It'll be fun. Come play with us. We're going to have a great time. There will be gluten-free things, I promise. Jill, I hand the floor back to you.
All right, perfect. I will do my final 30 seconds will be, I think one of the things that I'm most excited about in New York City and scaling up to New York State is the doula-friendly capacity for birthing facilities, for hospitals and for hospitals themselves and this is from the New York City Department of Health State of Doula Care 2023. I'll put that link in the chat. This is a wordy slide, but what I appreciate about this is for people who are here from a clinical perspective that are working in labor and delivery, it really gives a baseline of, does the current labor and delivery staff understand and have realistic expectations about doula support, doulas as part of the birthing team, and that like you can kind of just do the self-assessment. And then again, this is put together from doula leaders in New York State, the way that the birthing facility can increase awareness of doula support among patients. And this to me is where the rubber hits the road. The policies and practices in general about doulas and then about labor. So you can find this, and this will be expanded for doula-friendly hospitals through the New York Coalition for Doula Access, and they're going to do a learning collaborative about it and a community of practice. And you know, maybe this is something that New Jersey would consider doing also, with the wisdom of doulas who haven't been yet involved in community health or public health, but get their wisdom and expertise as part of what New Jersey can consider. So thank you.
That mute button is not going to get me today. Thank you, Jill. Thank you for being on the call. Thank you for sharing all of this with us. It's so much information in such a short window of time. I love that. Thank you for what you've brought, and everyone. We did record this call today. We're going to pop it up on our Facebook page. I believe that's my intention once I figure out how. So that people can access it and share it widely as well. And we're going to keep our community convenings going. These calls are so important for us to continue to have. I want to emphasize, I did see that Joni put in the chat, we have a doula survey going on currently in New Jersey. Please take the 5 minutes and go complete the survey for us. The link is the NJ Doula survey. All doulas, we want to know, what does your practice look like? What's the current present state of the doula? We want to know, and what do you need, and how can we be of support? So please take a minute, take that survey for yourself, post it, share it widely so that everyone else can chime in too. I will turn to the DLC team and ask, is there anything that we have not covered? Oh, the conference, May 29th. We have a conference coming, the NJDLC conference. This is going to be our 3rd conference. It's happening at Grounds for Sculpture in Trenton, New Jersey on May 29th from 10 to 3. We're going to have some amazing speakers, TBD. We're going to have some breakout sessions. We're going to do some doula practice things together. We're going to network with one another. It's going to be a lot of fun. So please come. DLC team. Is there anything we have not covered? in this time that we want to make sure we do.
No, thank you to Joe. No, she's not here, but also thank you, Jodi, for facilitating. And also thank you, all of you, for showing up. It really means a lot for you to be here with us, hold space with us, and continue as we have community. So thank you.
Thanks, everybody. I am happy to hang on the call. If there's anyone who has any questions or things that you wanted to ask that you want to check in with our team on, I'll hang out for a little bit. And if you don't have any questions, well, then I look forward to seeing you the next time. Thanks for being on the call today. And we will look forward to seeing you soon.
Jodi, can you stop the recording by any chance?
Yep. I did not begin the recording, but let me see if I can.